Assessing the nose and sinuses is an inspection and palpation of the external nose structure and sinuses, and inspection of patency of the nasal cavities. Assess the nose and the sinuses. First is you need to assemble all the equipments in the side, the nasal speculum and the flashlight or pen light. Then, the first procedure is inquire if the client has any history of the following diseases that will affect the nose. Do you have allergies? How about difficulty breathing through the nose? Sinus infections? Injuries to nose or face? Nosebleed? Any medication taken? Any changes in sense of smell? Then, position the client comfortably. If possible, the patient should be seated to assess the nose properly. Nose. Inspect the internal nose for any deviation in shape, size or color, and flaring or discharge from the nears. Then, lightly palpate the external nose to determine inner areas of tenderness, masses, or displacement of bone and cartilage. In palpating, you need to be careful. Then, gently palpate the external nose to know if there is a nodules and to know the tenderness of the nose. Determine the patency of both nasal cavities. Ask the client to close the mouth, exert pressure on one nares, and breathe through the opposite nares. Repeat the procedure to assess patency of the opposite nares. Breathe. Then after, inspect the nasal cavities using a flashlight or a nasal speculum. Since I do not have a nasal speculum, I rather use a flashlight. If you have a speculum, the procedure is hold the speculum in your right hand and inspect the client's left nostril, and in your left hand to inspect the client's right nostril. Tip the client's head back. Facing the client, insert the tip of the closed speculum about 1 centimeter or up to the point at which the blade widens. Care must be taken to avoid pressure on the sensitive nasal spectum. Stabilize the spectum with your index finger against the side of the nose. Use other hand to position the head and then to hold the light. The posterior turbinate early is visualized because of its position. Open the speculum as much as possible and inspect the floor of the nose, the anterior portion of the spectrum, the middle meatus, and the middle turbinates. Inspect the lining of the nares and the integrity and position of the nasal septum. Then, observe for presence of redness, swelling, growth on discharge. Then, inspect the nasal symptom between the nasal chambers. Then, facial sinuses. Palpate the maxillary and frontal sinuses for tenderness. Then, document findings in the client record. Assessing the mouth and the oropharynx. Assemble all equipments and supplies, the clean gloves, tongue depressor, gauze pads, and the pin light in the near your working site. Inquire if the client has any history of the following: routine pattern of dental care, last visit to the dentist, length of time ulcer or other lesions have been present, any denture discomfort, any medication. Okay, thank you. Then position the client comfortably seated if possible. Lips and buccal mucosa. Inspect the outer lips for symmetry of contour, color, and texture. Ask the client to purse as if to whistle. Then, inspect and palpate the inner lips and buccal mucosa for color, moisture, texture, and other presence of lesions. Teeth and gums. Inspect the teeth and gums while examining the inner lips and buccal mucosa. Inspect the dentures. Ask the clients to remove complete or partial dentures if in. Inspect their condition. Nothing in particular broken or worn areas. Tongue, floor of the mouth. Inspect the surface of the tongue for color, texture, and position. Ask the client to protrude the tongue and move it from side to side. Then inspect tongue movement. Ask the client to roll the tongue upward and move it from side to side. Move from side to side. Inspect the base of the tongue, the mouth floor, and the frenulum. Ask the client to place the tip of his or her tongue against the roof of the mouth. Then palpate the tongue and floor of the mouth for any nodules, lumps, or excreted areas. Use a piece of gauze to grasp the tip of the tongue and with the index finger of your other hand, palpate the back of the tongue, its border, and its base. Then, the salivary gland. Inspect salivary ducts opening for swelling or redness. Palates and uvula. Inspect the hard and soft palate for color, shape, texture, and the presence of bony prominence. Ask the client to open mouth wide and tilt head backward. Then depress tongue with a tongue blade as necessary and use the pen light for appropriate visualization. Then, inspect the uvula for position and mobility while examining the palates. To observe the uvula, ask the client to see so that the slow palate rises. Sige, ma'am, si A. 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 Oropharynx and tonsils. Inspect the oropharynx for color and texture. Inspect one side at a time to avoid the eliciting the gag reflex. To expose one side of the oropharynx, press a tongue blade against the tongue on the same side about halfway back with the client. Tilt head back, opens mouth wide. Use a pin light for illumination if needed. Then inspect the tonsils for color, discharge, and the size. Then elicit the gag reflex by pressing the posterior tongue with a tongue blade. Then document findings in the client's record. Assessing the neck is an examination of the neck muscles, lymph nodes, trachea, thyroid gland, carotid arteries, and jugular veins. Before in contact with the patient, use glove or sanitize your hand using an alcohol to avoid cross-contaminations among the client. Inquire if the client has any history of the following: any problems with neck lumps, neck pain, or stiffness, when and how any lumps occurred, any diagnosis of thyroid problem, any treatment such as surgery or radiations. Do you have history of that, ma'am? Okay, thank you. Neck muscle. Inspect the neck muscle for abnormal swelling or mass. Ask the client to hold head erect. Then observe head movement. Ask the client to move chin to the chest. Moves head back so that the chin points upward. Moves head so that the ear is moved toward the shoulder on each side. Then turn head to the right and to the left. Assist muscle strength. Ask the client to turn head to one side against the resistance of hand. Repeats with the other side. Shrug shoulder against the resistance of hands. Then I will put my hands on the patient's shoulder. Then let the patient shrug. Lymph nodes. Palpate the entire neck for enlarged lymph nodes. Trachea. Palpate the trachea for lateral deviation. Place a fingertip or thumb on the trachea in the suprasternal notch. Then move finger laterally to the left and right in space bordered by the clavicle. The interior aspects of the sternocleidomastoid muscles and the trachea. Use this. Thyroid gland. Inspect the thyroid gland and stand in front of the client. Observe the lower half of the neck overlying the thyroid gland for symmetry and visible masses. Then, ask the client to hyperextend head and swallow. If necessary, offer a glass of water to make it easier for the client to swallow. Then palpate the thyroid gland for smoothness. Notes inner areas of enlargement masses or nodules. If enlargement of the gland is suspected, osculate over the thyroid area for a bruit. Use the bell-shaped diaphragm of the stethoscope. Then, after, perform a hand hygiene to avoid cross-contamination. Then, document findings on the client's record.